Hello, guys. This is our fifth class, I think. So, this is the class about types of necrosis. We have already studied about necrosis and apoptosis and also the difference between them. So, today is the class of type of necrosis, which is a very common question, especially it is asked in viva and also in theory as well. So first of all, what is necrosis? I've already explained. Necrosis is a kind of cell death, but all those spectrum of morphologic changes that follows cell death is called necrosis. So there are 5 types of necrosis. Those are coagulative, liquefactive, caseous, fat and fibrinoid. We can remember this by C2, F2 and L. C2 means coagulative and caseous, F2 means fat and fibrinoid, and L means liquefactive. What is coagulative? As we know, coagulation means accumulation of something. So there are certain example of each of the following. Coagulative, the example of coagulative is MI, myocardial infarction or hypoxic cell of all tissue except brain. Coagulative, if the type is coagulative, it is saying it is except brain, but if the type is liquefactive, it is saying CNS system. So we have to remember this thing. In coagulative kind of necrosis, in the gross, if we are examining the cell during the gross examination, we can see in early stage the cell is pale, firm and slightly swollen, while in late stage we can see yellowish, softer and shrunken. So this is the feature of the coagulative necrosed cell. So during microscopic examination, we can see the cell. The outline of the cell is retained. That means we can easily examine what kind of cell it is and what is the type of that cell. It is easily recognized, but the inside is lost and it is coagulative. As we know, coagulation means accumulation. The insides are all accumulated with each other and the structure is all lost. So we can just easily remember through the name. If it is coagulative, we can remember the insides are lost but the outside is well retained, so we can easily identify what type of cell is that. And also obviously, if it is necrosis, we can see inflammatory cells. Some of the thing are, it is kind of a trick that you can easily write. Inflammatory cells are seen in every kind of necrosis because everywhere the inflammatory cells are seen. And also dead cells are phagocytosed, and here whatever the dead cell is, they are phagocytosed. And we have to know that necrosis, it is itself simply we can say cell death process. So of course there are some cells which are dying or which are dead. So obviously where there is cell dead, there is phagocytosis happening. So we can easily write that cells are phagocytosed. Now also liquefactive, second kind of necrosis is liquefactive. So what happens in liquefactive? As in the word itself, coagulation means accumulation, liquefactive means liquid. If we can remember coagulative is accumulation, we can easily remember that insides of cell are lost because they are all accumulated with each other, but the outside are retained. So we can easily write this thing. And during liquefactive, we can write soft with liquefied center. In the gross examination, we can see the cells are soft and insides are all liquefied center, but later stage a cyst wall is formed. In the wall of the cell, cysts are formed. So later on, if we are examining through microscope, we can see cystic space. In those cysts, in the space of those cysts, we can see necrotic cells, debris and macrophages. Obviously this thing we have to make our mind very sharp in this thing, that we can write debris and macrophages in all those parts wherever the thing dead cells is coming. Okay, so in microscopic examination we can easily write debris, necrotic cell debris are there, and macrophages are there. This will carry a lot of marks. And also so it is also very easy to learn. Liquid center is liquefied, and outside is obviously cyst, and inside the cyst, of course, there is very common that debris and macrophages are found. And next is gaseous. Gaseous example, tuberculosis. So example in tuberculosis, we can remember in cross examination we can find dry cheese kind of structure in the cells. The cells are kind of dry cheese. Now remember, how does dry cheese looks like? They are yellow, they are structureless, some kind of whatever. If you imagine a dry cheese, you can easily write the thing like the insides are very soft, granular, and obviously dry cheese is yellow in color. Yeah, this thing you can write here in cross examination. And also in microscopic examination, the cells are very structureless and granular debris. Of course, you can see here debris, dead cells. We can easily write these things everywhere. So debris are also found here, and the structure is dry cheese. We should not forget this. And next type is fat necrosis. Obviously, if we talk about fat, just remember where are the fats in our body: in our stomach, in breast. So example is pancreatitis, traumatic fat necrosis in breast. So these are the example. Now let's imagine, how does the fat look like? The fat looks yellowish and firm deposits. Wherever the fat is, there is calcium soaps. We should not forget this. So if here is the type fat, we can easily remember some of the things. Like example, we can remember, and we can remember it is yellowish in color and firm deposits are there, and also formation of calcium soaps are there. That means chalky white appearance can be seen in the cells. And in microscopic examination, we can see cloudy appearance. Obviously, if there are calcium soaps, chalky white appearance, that will obviously show cloudy appearance in the cells. So this is also easy to remember. So the next type is fibrinoid, and this is also very easy to remember. Fibrous. Can you remember where are the fibers? The fibers are in the muscles, they are in the vessels, obviously. So arterioles in so example is arterioles in hypertension, autoimmune diseases. We can find fibrinoid necrosis, because in hypertension, this is for example, if this is a vessel, blood vessel, in hypertension the blood is hitting the wall very hard. It is hitting several times throughout years and years. And if we hit something from time to time, then these things are hardened with time. Now you can remember this through this example. In hypertension, the arterioles are all hardened. So this fibrinoid necrosis can be found in this area. So the microscopic, if this thing are heated time to time for a long duration, local hemorrhage can be seen, because there are very minus blood vessels are seen here. So if something is hitting it very hard, then hemorrhage tend to be happen in this area. So local hemorrhage can be seen, and eosinophilic hyaline like deposition can also be seen in the vessel wall. So these are the feature of fibrinoid necrosis. So it is very easy to remember these things. I'm going to explain it again very shortly. So there are 5 types: C2F2L, coagulative, gaseous, fat, fibrinoid, liquefactive. Coagulative means we can remember it through accumulation, Coagulative means accumulation, that means insides are lost and outside is retained, and it is pale, firm and slightly swollen, but later on it is yellowish, softer and shrunken. And of course dead cells are phagocytes, and inflammatory cells are seen. And in liquefactive, we can remember it through liquid. It is caused by fungal bacterial infection. During the cross examination, we can see liquefied center, and the outer wall is in the outer wall cyst is formed, and inside the cyst, of course, there are debris and macrophages seen. And in caseous, we can remember it through tuberculosis, and it resembles dry cheese. And how does dry cheese looks like? It looks like soft, granular and yellowish, so we can easily remember through this. And in microscopic, it is structureless granular debris are seen. Fat, how our fat looks like? They look like yellowish and foam deposit. Wherever there is fat, there is calcium soaps and cloudy appearance is seen. And where are fats in our body? Stomach, breast. That means the example are acute pancreatitis and traumatic fat necrosis. And the last, fibrinoid. Of course, fibrinoid necrosis is found in arterioles in STN and autoimmune disease. Microscopically, we can find local hemorrhage can be seen, and eosinophilic highly-like deposition are seen on the vessel wall. So at a glance, the types of necrosis are at a glance: coagulative, liquefactive, gaseous, fat and fibrinoid. C2, F2 and L. Coagulative, gaseous, fat, fibrinoid and liquefactive. So in coagulative, except brain, everywhere coagulative necrosis can happen. If this is the cell, the pale, firm, swollen in the early stage and yellowish, softer and shrunken in the later stage, and outline are retained. That means we can easily identify the type of cell, but insides are lost, because coagulative means accumulation, and accumulation means insides all of the particles are accumulated and we cannot find out what are inside. So next is liquefactive. Liquefactive means liquid. Soft liquefied center with necrotic debris are found, and outside cyst wall is formed. It, for example, fungal or bacterial infection in CNS. Caseous, for example, tuberculosis. In tuberculosis, the cells resemble dry cheese type, that means yellowish and softer in inside, and foci are structureless. Fat, in the fat, the example are acute pancreatitis, traumatic fat necrosis in breast, because this area the fat are most commonly found. So it is yellowish and firm deposits can be seen, formation of calcium soap can be seen, and cloudy appearance can be seen in microscopically. Fibrinoid, any arterioles in hypertension or any autoimmune disease, the vessel wall are in the vessel wall, eosinophilic hyaline-like deposition can be seen, and local hemorrhage can be seen. Okay, thank you. Today's class is finished for now, and let's meet on another class.